Over the past few months, we've been reporting on the large number of women across the country who believe that they have breast implant illness. The symptoms are everything from autoimmune disease to depression. Well, the patient you're about to meet says she saw our series and wondered if her symptoms could be caused by her implants. Then just a few weeks later, it got very serious. In fact, she's one of the first in San Diego to be diagnosed with an implant-associated cancer. While on this trip to Romania with her son back in April, Jean Silverwood got a call that changed everything.
It was a shock. It really was. I sat and I was kind of in silence for a couple of hours and I couldn't believe it.
The Rancho Santa Fe resident says it took a while to set in that 18 years after getting breast implants, they were the cause of her cancer diagnosis.
It's so rare. Every article I read, it said it's so rare. And, you know, if you have the textured implants, don't worry about it because this is such a rare cancer.
The 60-year-old mother of 4 was diagnosed with BIA-ALCL, a breast implant-associated type of lymphoma. Her first symptom was that her left breast was beginning to enlarge and fill with fluid. And over the past few years, she just hasn't felt like herself.
Well, I saw your story on the breast implant sickness in February, which, you know, at the time I said, wow, I wonder if I have that.
It's heartbreaking that you think that we did this to ourselves.
In February, we aired my 2-part series on breast implant illness, showing the thousands of women all having their breast implants removed because they believe the implants are making them sick.
A lot of the symptoms that you were talking about were things that I had experienced.
But because Jean had textured implants, her doctors were extra concerned.
Jean is somebody who I would describe as well-tuned to understanding what's going on in her body.
Dr. Salvatore Pacella is the head of plastic surgery at Scripps MD Anderson Cancer Center and believes Jean may be one of the first in San Diego to be diagnosed with this.
ALCL is a very rare cancer. So far, right now in 2019, I think the numbers show us that only about 700 to 800 women in the world have been diagnosed with this problem.
Dr. Pacella says the idea behind textured implants is that the rough outer shell can minimize scar tissue buildup and help the implant stay in place. Due to the cancer link, 38 other countries have banned them, including France and most recently Canada. But just last month, the FDA says at this time it will not be issuing that ban.
Nothing in the FDA ever surprises me. Sometimes they're predictable, sometimes they're fairly unpredictable. But I do think they honestly look at the risks associated with the general community and weigh the benefits and risks associated with textured devices.
As for Jean, she had her implants removed. This one even shows it covered with tissue from the lymphoma. Now she hopes to get back to running and helping other women know the signs and symptoms.
I have a feeling that it's not going to be as rare as they're saying it is.
Well, Jean says a mammogram won't pick this up, and she encourages women to be persistent. In fact, it was an MRI followed by a fine needle aspiration that finally gave her some answers.
Wow, what an eye-opening story, and she talked about how rare it is. It's so rare. So it's not rare when it happens to you.
It doesn't feel rare all of a sudden. And to give you an idea of the difference between the implants, I've been covering the story for several months, so bear with me because these have been sitting on my desk for quite some time. This one that I have right here in my hand, this is the textured implant, and you can see it's more translucent. It's got this rougher outer shell compared to the smooth surface implants, and these textured implants are the ones that are linked to this particular type of cancer.